Otitis externa, commonly known as outer ear infection or swimmer's ear, is an inflammation or infection of the external ear canal, which runs from the outer ear to the eardrum. This condition can affect people of all ages and is often associated with water exposure, but it can also occur due to other factors. Causes: otitis externa can be caused by various factors, including bacterial infection, the most common cause, often due to bacteria such as Pseudomonas aeruginosa or Staphylococcus aureus. Fungal infection. Fungal infections, such as those caused by Aspergillus or Candida, can also lead to otitis externa, particularly in individuals who have had prolonged moisture exposure. Allergies. Allergic reactions to substances like hair products, earrings, or even skin conditions like eczema can contribute to inflammation. Water exposure. Frequent exposure to water, e.g., swimming, can lead to moisture accumulation in the ear canal, creating an environment conducive to infection. This is why it is often referred to as swimmer's ear. Trauma. Inserting objects into the ear, e.g., cotton swabs or scratching the ear canal, can cause breaks in the skin, making it susceptible to infection. Skin conditions. Conditions like psoriasis or eczema can predispose individuals to developing otitis externa. Symptoms. Symptoms of otitis externa can vary in severity and may include ear pain, typically sharp or itching, often worsening with movement of the ear or jaw. Itching, a persistent itch in the ear canal. Redness and swelling, visible inflammation of the ear canal. Discharge, fluid or pus may drain from the ear. This can be clear, cloudy, or even foul-smelling. Hearing loss, a sensation of fullness or muffled hearing due to swelling or discharge. Fever, in some cases, especially with severe infections. Diagnosis. Diagnosing otitis externa typically involves medical history. The healthcare provider will ask about symptoms, recent water exposure, any prior ear infections, and history of skin conditions. Physical examination. A thorough examination of the ear using an otoscope to visualize the ear canal and tympanic membrane eardrum is performed. Culture tests. In cases of persistent or severe infection, the healthcare provider may take a sample of the discharge for laboratory analysis to identify the specific bacteria or fungi causing the infection. Treatment. Treatment for otitis externa focuses on relieving symptoms, eradicating the infection, and preventing future occurrences. Ear drops. The primary treatment typically involves antibiotic or antifungal ear drops. These may also contain corticosteroids to reduce inflammation. Antibiotic drops, such as ciprofloxacin or ofloxacin. Antifungal drops, such as clotrimazole for fungal infections. Oral medications. In cases of severe infection or if the infection spreads, oral antibiotics may be prescribed. Pain management. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage discomfort. Ear cleaning. A healthcare provider may clean the ear canal to remove debris and discharge, which can help alleviate symptoms and promote healing. Preventive measures. Keeping the ears dry during water activities, e.g., using earplugs or a swim cap. Avoiding the insertion of objects into the ears. Using a hairdryer on a low setting to gently dry the ear canal after swimming or bathing. Prognosis. The prognosis for otitis externa is generally good, with most cases resolving within a few days to weeks with appropriate treatment. However, if left untreated, it can lead to complications, including chronic otitis externa. A long-lasting infection can develop, requiring more aggressive treatment. Cellulitis. Spread of the infection to surrounding skin or tissue. Eardrum perforation. Rarely, the infection can lead to a tear in the eardrum. Hearing loss. Persistent infections may affect hearing temporarily. Conclusion. Otitis externa is a common and generally treatable condition that can cause significant discomfort. Understanding the causes and symptoms, along with prompt medical evaluation and treatment, is essential for effective management. Taking preventive measures can help minimize the risk of developing future infections, especially in individuals prone to otitis externa. If symptoms persist or worsen, it's important to consult a healthcare provider for further evaluation and treatment.